Waldman.
Speaker, we yield back the balance of our time in this segment to the floor.
Representative Waldman.
Thank you. Excuse me, I yield to Representative Pafford.
Representative Pafford in debate.
Thank you, Mr. Speaker. And before I tell everybody I'm not going to support the bill, Representative Hudson, you've done a tremendous job with this bill. You've gotten it to a point where it's very, very close to, for me to support getting rid of the decentralization language, those type of things. Excellent. Representative Diaz made some very good points. A few things I have concern with are some of the things relating to changing statute that might diminish the role of the state's Surgeon General. However, I think that the real thing that most concerns me is the AG Holley deauthorization by the Department of Health to operate. There is a portion of the bill that allows DOH to go into a contract. They're authorized to do that for a TB treatment program. But unfortunately, I don't feel that the legislature knows enough about that program. It's about $10 million to operate the hospital in Palm Beach County. We've heard estimates of up to 18 if it goes private. There are hospitals that have suggested they'd be able to assist some of these people, but these folks, on average, close to 30 or 29 patients on average at this hospital. Today, I think there's probably 40 there. They are a very, very complicated, difficult set of patients to deal with, and not having a secure plan to move them to a different facility is of concern, I think, and there might be a public safety issue. With that, Mr. Speaker, thank you very much. Representative Hudson, again, you did a great job. Unfortunately, not today.
Representative Waldman.
Thank you, Mr. Speaker. I yield the remainder of our time in this segment to the floor.
Representative Frisch.
Thank you, Mr. Speaker. I yield to Representative Wood.
Representative Wood in debate.
Thank you, Mr. Speaker. Members, as the one of the leaders in the health care committees, I want to commend Representative Hudson for his hard work. He really has taken the time to look at this agency very closely. As a member of his Health Appropriations Committee, we were out at Southwood touring through the various buildings, talking to people, talking about the mission of the agency. The issue that Representative Pafford brought up, I know that Representative Hudson has spent a great deal of time looking at that issue, looking at alternatives. I'll leave that for him to tell you about. But I think the work of this bill reflects a substantial reform and efficiency in this agency, and I'm proud to stand up and support the good work of Representative Hudson in bringing us a package that we can all support and know that heads this agency in the right direction. Thank you very much, Mr. Speaker.
Representative Frisch.
Thank you, Mr. Speaker. We yield the balance of our time in this segment to the floor.
That concludes our debate. Representative Hudson, you're recognized to close.
Thank you, Mr. Speaker. And while I basically waived my opening, I am going to take a moment to close. The Department of Health has been something that I've been very passionate about, looking at how we can create a better Department of Health for the citizens of Florida. Members, let me explain to you very quickly what this bill does not do. It does not diminish the role of the State Surgeon General. It does not diminish the role of the Department of Health to promote public health. The bill does not get rid of the Division of Environmental Protection, as some might assume. The bill does not get rid of child protection teams and CMS. The bill does amend a number of different areas of statute, and it does provide for a more streamlined, efficient Department of Health that will be able to provide critical services to your constituents. They will be able to do so in a way that is cost effective. They will be able to do so in a way that will deliver the services necessary when people actually need them. It structures CMS to combine the two divisions into one and save administrative costs. Yes, there's much talk about AG Holley. Folks, we've been talking about AG Holley for a decade or more. And there's been plan after plan after plan. Well, the time is now. We spend $10 million on a hospital with 29 patients. The hospital needs almost $8 million of capital repairs. it's time that we dust off those plans and get to work. It addresses nursing student loans and takes them to the Department of Education where they should actually be. It addresses public bathing places. It addresses the issue of medical quality assurance. Shouldn't every licensed healthcare practitioner in the state of Florida be able to receive a good, efficient, quality application and licensure process? This bill addresses that for your constituents. It also addresses the Women's and Infant Children program and makes for a better process there. Members, this was a work of a lot of people, but I'd be very, very remiss if I did not address three people who worked very hard on this bill. Carol Gormley, Krista Calamus, and Leah Holt. Our staff is second to none, and I appreciate their help very, very much. We have a great team that puts all these things together and works with us to dig into things. And members, I ask you, for our 67 counties and for the great state of Florida, do you want a department that will actually be focused on its true mission, and that is health for all Floridians? If you want that, please, I ask for your support for this bill.
The question now occurs on final passage of